Hi, this is Dr. Jennie Byrne. I'm an adult psychiatrist. I have a private practice, Cognitive Psychiatry of Chapel Hill. And I wanted to talk to you today a little bit about anxiety and some treatments for anxiety which are not medication. A lot of people ask me about this topic, and it's really important for people to understand some of the choices they have if they're suffering with anxiety. So, as I've talked about in some of my other videos, anxiety is an extremely common problem. Probably 1 out of 3 people have some kind of anxiety sometime in their life, and it can show up in different ways. Sometimes it feels like nervousness, sometimes it feels like worry, sometimes you feel it really in your body, like you feel really tense or your stomach's really upset. You can feel it in your body. And the ways to treat anxiety are both medication and non-medication. So I'm not going to talk about medicine today. Some of the non-medication things you can do are, and I'll kind of go in the order I think of importance. Number 1, I would say, is probably exercise for anxiety. And the reason for this is when you exercise and you do that cardio where you're kind of sweating a lot and your heart's going really fast, you're burning off some adrenaline, which is a chemical in the body which is also involved in anxiety. So if you kind of burn off some of that adrenaline during exercise, it's less likely to show up as anxiety. So exercise is a really great way to kind of start targeting your anxiety. A second thing I talk about is sleep. Sleep is really important. If you don't get enough sleep, you're definitely going to be more anxious. So again, it's kind of the sleep routine sometimes being more important than the total amount of sleep. So instead of worrying about, am I getting 8 hours of sleep or not, worry about, am I going to bed at the same time? Am I waking up at the same time? Is the place I'm sleeping, quiet and dark and calm? That can be very important. Number 3, I guess I'd probably say is getting out of the house and socializing and doing things. One very common thing with anxiety is you start worrying about worry. And what that means is after you start worrying a lot, then you start anticipating the worry. So you might worry like, well, if I go driving, I'm going to get worried, and then what's going to happen? Or if I go to this person's party and I start to worry, well, what am I going to do then? And there's kind of this anticipating worry, and that can build up and up and up, and over time, people can even get trapped in their homes because they're too worried about leaving. So that's certainly something you don't want to happen to you. So the more you can kind of get out and try to get past some of those worries, the better. Finally, I think another thing that can be very helpful is this idea of mindfulness. And when I say mindfulness, that can mean a lot of different things. What I mean is being aware of your own thoughts and feelings. And this is actually pretty hard to do. So this is where you're trying to identify what thoughts are popping into my head. How do I feel? How do I feel in my body? How do I feel in my emotions? And trying to step back from yourself and kind of observe how you're feeling. Sometimes this exercise can really help with anxiety because just the process of stepping back and observing can really bring down the intensity of the anxiety. So of course, if all these things fail, these kind of self-help measures, you can always seek professional help. There are a lot of different kinds of talk therapy which are used for anxiety. The one that I like the most is called cognitive behavior therapy. That's a form of therapy that you do with a counselor or psychiatrist, and you focus on your thoughts, your feelings, and your behaviors. And you do exercises, sometimes you diagram things, sometimes you take homework that you work on in between your sessions, sometimes you practice with the therapist. And you're really, again, kind of gaining that self-awareness and then doing these homework exercises to practice what you've learned. So that's a form of therapy that I really like for anxiety, but there are other kinds out there as well. Some of them are called supportive therapy or interpersonal therapy. There's a lot of different kinds. But the bottom line is if you try the self-help things and you're still struggling, you're still having a lot of anxiety, I do urge you to go out and get some help. And just to keep in mind, it doesn't have to be medication. There are lots of other options. And just one final note is that psychiatrists are not just about medication. Some are, but there are many out there who like to do therapy as well. So just because you see psychiatrists, don't assume that they're going to force you to take medications. They might be just as happy to do some of the therapy with you. So I hope this was helpful. If you have more questions, feel free to contact me or check us out on social media on Facebook or Twitter. Take care and have a good day. Bye-bye.